In its response to the full-scale healthcare crisis, the South Korean government has now announced some swift action to improve the pay and work conditions of young doctors. Several doctors had in fact gone on a strike last week, paralysing the entire healthcare sector in South Korea. Our next report gets you more details.
South Korea will move quickly to improve pay and working conditions for young doctors on Friday. That's according to Prime Minister Han Duck-soo, who said long working hours were partly responsible for doctors' mass walkout, and that must be changed. Authorities announced new measures to tackle a key demand by medical trainees who have walked off their jobs, but denied there was a full-scale healthcare crisis in South Korea, which has one of the world's fastest aging populations. More than 10,000 medical interns and resident doctors have protested over a government plan to increase medical school admissions. They say the government should first address their pay and working conditions before trying to ramp up the number of new physicians. Weeks of protests have led to cancellation of some operations and strained emergency departments. President Yoon Suk-yeol previously took a hard line against the strikers, taking steps towards suspending their medical licenses. According to the new measures, trainee doctors in pediatrics will receive an allowance of around $760 starting this month. The government also plans to allocate an additional budget for trainee doctors, and will start with those in essential specializations such as emergency medicine and general surgery. The striking doctors and medical associations that have been critical of the government did not immediately comment on the proposals.
WION is now available in your country. Download the app now and get all the news on the move.